Well, certainly I want to look at ways, particularly of a market-based solution, to make health care more accessible and more affordable for Americans. If you look back to where we've been in terms of where Obamacare came on the scene, it increased the insurance cost, both in terms of premiums and in terms of the amounts billed. And if you talk to people, they'll tell you they think they have less access to better health care now than they did before that. And so the way it's been set up has just been wrong from the jump. And so I hope that there's the courage and the foresight here, frankly, in both parties, to try to come up with something that works better, that's more of a market-based approach, that gets rid of these taxes that are involved, gets rid of all this extra money that's wasted, the money, frankly, that's spent on the bureaucracy. Put that in actually giving health care outcomes for folks.
Well, I hope it goes as normal, in regular order. As we've said, all 7 weeks so far. Just open up the government and we'll negotiate on anything. That includes health care and the subsidies to try to prop up Obamacare, which is a failed program anyway. But we'll talk about it. But that gives us also the opportunity to offer solutions that would work better for the people. You know, in my committee on education workforce that I chair, we have the Association of Health Plans, for instance, as one item that could be a major impact for businesses as well as their employees, giving them an opportunity to have a better health care at a reduced cost. And we saw that actually work under President Trump's first term, when for about 6 months, he, with an executive order, gave opportunity for Association of Health Plans to be implemented. And we saw a 30% reduction in the overall cost of health care for those that involve themselves with that Association of Health Plans. So those are things we can talk about. There are other things we can put on the table as well. But when we're shut down unnecessarily, we can't do that.
Well, you know, the shutdown is kind of one of these things that should never have happened. Because in the House, we passed our legislation on September the 19th, and we funded everything. We funded, you know, from, you think of our military, you think of the people in air traffic control, you think about our border patrol, everyone was funded, SNAP, WIC, everything. It was the Senate Democrats under the minority leader that shut us down, Senator Schumer. And so, you know, it took 15 tries over there before they ever got things done. What Senator Thune said, and also here in the House, they said, look, number one, we're going to get to that date we had to have on November the 21st, so we get our other appropriation bills done, because that, you know, and it was kind of an odd thing, is that the Democrats were voting against Biden-era spending. And so this is why it was a clean CR. We gave them exactly what they wanted. So I know that Senator Thune and some of the Republicans over in the Senate said, yeah, well, we can always talk, but we have to get through where we are. And so it's also important for people to understand that when you're talking about what's out there, is that we're not talking about they're getting rid of Obamacare or the Affordable Care Act, in which we're finding out since 2010 it hasn't not been affordable at all. And that's what all the American people were told when this thing was passed. And I had voted against it back in 2010. But what we saw happen was the Democrats, during COVID, it was their excuse, they came up with saying, well, we're going to have to put these subsidies in. Not one Republican ever voted for Obamacare. Not one Republican voted for any of these massive $10 trillion spending bills that the Democrats had. The Democrats had their opportunity, but it was so high in cost, that's why they made it 5 years, and so make their numbers look where they are. So I think what you're going to see is that, you know, over in the Senate, they're going to have the opportunity to have a bill up that, later, I think it's in December, is what Senator Thune said, and they'll proceed from there.